The Medical Imaging and Data Resource Center is the imaging community's response to the COVID-19 pandemic. MIDRC is supported by the National Institute of Biomedical Imaging and Bioengineering. This consortium is supported by the American College of Radiology, the Radiological Society of North America, the American Association of Physicists in Medicine, and 20 other academic institutions, private practices, and the US Food and Drug Administration. MIDRC is hosted at the University of Chicago. The principal investigators of MIDRC are drawn from these organizations. The purpose is to develop machine learning algorithms that will help to identify COVID-19 infection, diagnose COVID-19 and distinguish it from other infectious and non-infectious diseases, assess the extent of disease, monitor therapy, including therapies that are just coming on the market, and detecting complications like pulmonary embolism, and predicting outcomes like admission to the hospital and the ICU and mortality. The 3 North American imaging organizations are responsible for ingesting imaging data. Data is then transferred to MIDRC Central at the University of Chicago, where it is made publicly available on the Gen 3 platform. There are 2 data intake portals, the RSNA's COVID-19 database called RECORD and the ACR's COVID-19 Imaging Research Registry. These data are de-identified, curated, assessed for quality, harmonized with the MIDRC information model, and annotated for machine learning experiments. AAPM has special expertise in assessing image quality and in these rigorous methods of evaluation. The data is then made available on the Gen 3 platform at the University of Chicago, which is available at data.midrc.org for investigators to search the data, build cohorts, and download the data for further experiments. This is an open public commons, which is AI and machine learning ready, trustworthy, and adheres to the FAIR principles and is representative of the population. Some of the data are sequestered to expedite benchmarking and regulatory approvals. The sequestration process takes 20% of the data set and keeps it hidden. No access is permitted so that these data can be used for independent testing of AI and machine learning algorithms. 80% of the data is made public on the data commons. And you can see the demographic mix of the data that is public and the sequestered data is very similar. This facilitates regulatory clearance and post-market evaluation because the independent test set maintains its integrity. Each time an algorithm is tested against that independent data, a task-based random sample of that test set is matched to the clinical use case and the patient population. Currently, we have ingested over 60,000 studies, mostly chest radiographs and computed tomography of the chest. 50,000 of these are undergoing quality assessment, including assessment of the diversity mix of the data and selection of cases for sequestration and algorithm validation. Approximately 13,000 studies have been made publicly available as a curated, high-quality, diverse, and representative set of imaging studies for researchers to download. As a result, more than 24 machine learning algorithms have already been built to diagnose COVID, assess prognosis, measure disease severity, and predict length of hospital stay. The data come from across the United States, and as a result, the ethnic and demographic mix of the data are very close to the ethnic and demographic mix of the census data from 2020. MIDRC partners with a number of organizations, including SPIE, the American Society of Neuroradiology, and the Academy for Radiology and Biomedical Imaging Research. In addition, MIDRC works with a number of other NIH repositories of COVID data, including N3C, which contains over 1 million electronic health records on patients who have had COVID, and the Biodata Catalyst repository from the National Heart, Lung, and Blood Institute, which contains genomic and other information on COVID patients. This allows a multimodal view of the patient to include imaging and non-imaging information to make an assessment or diagnosis of these patients. The MIDRC community is growing. We have a monthly seminar series that highlights the work of our researchers. We also hold quarterly town hall meetings, which can answer your questions about contributing and downloading data. All of these sessions are made available on our YouTube channel called MIDRC Media. You can subscribe to our newsletter to find out about all of these sessions using these QR codes or by going to midrc.org. We are delighted to be a part of the solution to the COVID-19 pandemic. Our philosophy is for every medical image, a patient has already benefited through medical care, and a hospital or medical center has already received reimbursement. So now the public can benefit from this data by the secondary use of the images by MIDRC, so that we can all help change the future of medical imaging and increase our impact on public health. Thank you.